Dear world, dear people, my name is Sabrina. I'm 16 years old, grade 11 student from Shenzhen No. 3 High School, China. It is my great honor to be invited to join in the World Speech Day. Before I begin, I would like to ask you whether you feel anxious because of pressures in your life, work, and study. Do you feel nervous when you take on a task in a competition and you don't know if you are ready? I think the answer is yes, but isn't that a normal thing? Of course, for us, it is a very ordinary little thing. It may not affect our life. Instead, it may even become our motivation to not give up. But have you ever thought about that there are people in this world, and their world, they will be affected by these little things? The strange thing is that they never bleed, will not have a fever, but their inner world will be sick. And that's what I want to talk about today. People we call people with mental illness. As a student who wants to learn psychology, I have been paying attention to the groups of patients with mental disease since junior high school. During the 4 years of observation and research, I found that these patients are no different from ordinary people on their surface. But once they got sick, they may have a series of problems, the most serious of which is suicide. So how do we put human mental illness in perspective? The World Health Organization estimates that about 786,000 people worldwide commit suicide every year. The rate is 10.7 per 100,000 people per year, which means that someone kills themselves every 40 seconds. The data stuck in me like a knife. And I wonder, if we accept mental illness properly, if we think about mental illness properly, if we care about it, will these numbers go down because of us? So how do we accomplish this? First of all, we should clearly realize that mental illness is not a terrible thing. Mental illness is caused by brain dysfunction, from internal and external pathogenic factors acting on people, which destroy the integrity of human brain function and the unity between the individual and external environment. Psychology disorder is a human disease that can be controlled by drugs and recovered from slowly. Common diseases include depression, mania, delusion, and anxiety. Often these patients are shamed into concealing their condition. Therefore, when people say they suffer from a mental illness, we should clearly recognize that mental illness is just like any other common illness and understand and tolerate it. Because all human diseases are common, if people around us have psychological problems, it also means that each of us is likely to have psychological problems. The second way to accomplish our goal is through kindness. If the person's disease is not helped by understanding and tolerance, actively support them to accept the treatment of therapists and doctors. If it is just a simple psychological problem, then we need to actively help them, communicate with, and take care of them. Finally, we must learn to endure. A patient's psychological problem may not allow us to adapt or become used to. However, while we may not be able to avoid situations where a bad mood affects us, this situation are also a part of learning to adapt and understand others. Doctors once said, the only people in the world who can lighten the burden of others are not ordinary people. When we really recognize this group and see them in the right way, we will find that this is not a very difficult thing. This is something we can do with our hands. When we use loving and caring hands to help people, the whole earth will be pushed by us. Humans will be more and more healthy, and the world will be more and more harmonious. At this moment, I'm standing here to tell people all over the world to accept those people suffering from mental illness with both hands, influence them with heart, learn them and help them to see the blue sky that belongs to them again. That's all my presentation. Thank you for your attention.